Diabetes is a chronic metabolic disorder characterized by high blood glucose levels. The Diabetes Care Cascade is a comprehensive assessment of the activities of diagnosis, treatment, and glycemic management among a population of people living with diabetes. A cascade of care analysis is important because it allows identification of where in the continuum of clinical care the greatest strengths or weaknesses occur in a given setting. This information can help facilitate the development of targeted interventions to address any gaps in diabetes management. A previous study from IHME projected that every country in the world will continue to see increases in diabetes prevalence, culminating in over 1 billion people living with diabetes in 2050. Therefore, it's even more critical to understand where diagnosis, treatment, and glycemic management can be improved in order to prevent disabling complications. We found that in 2023 globally, nearly 56% of people living with diabetes were aware of their condition, yielding almost 250 million people undiagnosed. High-income locations were generally doing better in diagnosing people compared to low and middle-income locations. Among people with diagnosed diabetes, over 90% were receiving treatment with insulin or other hypoglycemic medication. Among people receiving treatment for diabetes, only about 40% were maintaining optimal glycemic levels. Young adults with diabetes were far more likely to be undiagnosed compared to older adults. While both diagnosis and treatment coverage improved by about 8 percentage points between 2000 and 2023, the proportion maintaining optimal glycemic levels among those who were treated only increased by 1 percentage point. So here we're seeing in percentage space the diabetes cascade of care proportions over age. So in red, we're seeing the proportion of people diagnosed among those with diabetes. In blue, we're seeing the proportion of people treated among those with a diabetes diagnosis. And in green, we're seeing the proportion of people with optimal glycemic concentrations among those receiving treatment for diabetes. And the main takeaway here is in red, we can see a very stark age pattern, where in younger ages, a lot of people are undiagnosed. First, prevention of diabetes remains critically important, primarily through reducing obesity. Given our current trajectory of continually increasing diabetes prevalence globally, it is critical to continue efforts to expand diabetes education and screening programs. In low and middle income countries, this will mean more diagnostic capacity building, such as by training more healthcare personnel and stocking up on diagnostic tests. Greater focus on screening young adults with risk factors for diabetes is critical to address the high underdiagnosis in this population. In this map, we're seeing country-level proportions of those diagnosed among people with diabetes. And we can see that countries in Africa, in sub-Saharan Africa, have generally low diagnosis rates, whereas high-income countries such as the United States and countries in Europe have higher diagnostic rates. Finally, more efforts to support people receiving diabetes treatment and achieving sustainable optimal glycemic levels is critical. This may include expanding access to novel diabetes and obesity treatments that are often unaffordable and providing more support to help people with diabetes navigate complex treatment regimens.